Next, I want to ask you about the patients who need to move forward with their surgery, who can't have their surgery delayed. Let's talk about someone, let's say, who has triple negative breast cancer where there are no receptors for estrogen, progesterone, and HER2, who have had chemotherapy up front, and they've finished their chemotherapy, and now they're ready to move forward with their surgery. Tell us about how you handle that situation as a surgeon.
So this is considered one of our category, it's a high priority category B surgery where you don't want to delay that, so that you want to get the patient into surgery in that period of time between 4 and 10 weeks after their chemotherapy. I particularly like, 4 to 6 weeks is my usual window, and I'm sticking to that during this time because it is within the recommendations. I did 2 patients just this week, someone that came in from Wyoming and another patient that drove another hour and a half who had completed their chemo, and this was their window for their surgical procedures. And they went off without a hitch. We are, doing some measures in the operating room when the patient's being intubated. Other staff members are leaving the OR. The anesthesia team is wearing an N95. So we're taking precautions that were recommended, for safe surgical procedures. Obviously, if patients were symptomatic, we would not bring them. If we thought or suspected someone was a COVID carrier, we would not bring them into surgery. But at this point, we are still proceeding with those procedures because it's part of a staged process, and the potential detriment to the patient is greater than the risk of going through surgery now.
That's so well said. Thank you. For patients who are HER2 positive and who had their chemotherapy together with a targeted medicine like Herceptin, Perjeta, or both, and they've just completed their chemo-targeted therapy, and their next step would be surgery, do you also proceed immediately with those patients as well, or are those patients allowed to be delayed?
So because Herceptin is a targeted therapy, this was one of the ones where it's a little bit more of a gray zone. Those patients are going to continue on some type of therapy, so they could be delayed if needed. So in patients that have significant comorbidities, asthma, diabetes, obesity, that's a patient that I may consider waiting for the 10 to 12 weeks because they're going to still be on the Herceptin therapy, and particularly if they were a triple positive, their estrogen receptor was positive as well. But if the patient has completed their therapy and they have no other significant comorbidities, we would still do the same 4 to 6 weeks after surgery for their definitive care.
That's really helpful. Thank you.